Relief could be on the way for millions of Americans struggling to afford prescription drugs. The White House today unveiling the first batch of prescription drugs selected for Medicare price negotiations. That power provided to the federal government as part of President Biden's Inflation Reduction Act. 10 drugs were named today. You see them there. They include medications for cardiovascular issues, diabetes, autoimmune disease, and cancer. The price change won't take effect until 2026, but it could save Medicare tens of billions of dollars over the next decade. With more on this, we are joined now by the White House Press Secretary, Jean-Pierre. Welcome to the show for the first time.
Thank you so much, Alex, for having me. Appreciate the time.
So what is the basic idea here?
So the basic idea, you did a great job laying it out. Look, a year ago, the president and Democrats only in Congress passed the Inflation Reduction Act, which was a historic piece of legislation. And as you pointed out, part of the provision is to allow Medicare to be able to negotiate with pharmaceutical companies, which is something that that leaders have been trying to do for decades, for about 33 years. And this president was able to make that happen. What that means is that he was able to beat Big Pharma. So this is huge, really big for Americans across the country. If you think about these 10 prescription drugs, they are going to save 9 million people across the country. They're going to give them some savings. If you look at what those 10 drugs cost just last year in 2022, those 10 drugs cost $3.4 billion in 1 year alone, about $6,000 for one drug out-of-pocket cost. And that's what Americans are dealing with. Those are the difficult decisions that Americans have to make every month around that kitchen table. You hear the president talk about this. You hear the president talking about giving Americans a little bit of breathing room. And so now they don't have to make that difficult decision, or if they're going to pay for a drug that they need, or if they're going to have to pay for another necessity, right? And so this is how he was able to beat Big Pharma. This is one of the most critical pieces, part of that provision that Americans are going to see, including in California, including in Los Angeles.
So when you look at these drugs, if anybody's ever watched the evening newscast, this is basically every sponsor for the network evening newscast. Let's put the names up on the screen. I mean, these are pretty familiar names when we look at the full screen of the drugs that we're talking about here: Jardiance, Xarelto, Januvia. So why these particular 10 drugs? And are these the only 10 drugs?
All great questions. First of all, there's a criteria that these drugs have to make that is decided by HHS, the Human Health Services. If they met a criteria, that's why you see those first 10 drugs. There will be additional drugs. So if folks don't see their drugs on that list, do not worry. It may come down the road. You might see your drug on the list. And let's be very clear. These are drugs that are going to help people who are dealing with cancer, dealing with blood clots, dealing with heart disease. These are critical, important drugs for Americans, not just in LA, obviously across the country. And so we're proud of this. We're proud about what we've been able to do, the president has been able to do and deliver for the American people. Again, lowering costs, lowering medical costs, healthcare costs. And that is something that has been at the top of the president's mind as we talk about Bidenomics, as we talk about getting the economy back on its feet, which is something the president has been able to do the last 2 years.
But a key point also, not till 2026 until we actually see this relief, right?
No, you're right, Alex, not until 2026. But now this is one critical provision of the Inflation Reduction Act. The Inflation Reduction Act has already done some really important things if you think about the healthcare costs. 15 million Americans are seeing their healthcare costs go down by $800 per year. That's really critical for those 15 million Americans. You think about the insulin cost, the insulin cap at $35 per month for seniors. That is a game changer for our seniors out there. So we are seeing the effect of the Inflation Reduction Act. That is also important as well.
And as we wrap things up, one question about you, since this is your first time on the show, and obviously one of the most high-profile people in the administration. What is a day in the life of you like? Obviously, every day is a little bit different, but what's like a typical day for the White House press secretary?
That is such a good question. And you really hit it right on the nose. Every day is very different. I am talking to you right now, Alex, about a very important announcement that this administration is making on Medicare costs. That's so important. So that, that's one of the key parts. We're always talking about what we're doing for the American people. So that happens. But my day starts pretty early, 4:30 in the morning. I get up, I start reading in. I have my first meeting at around 7:30 in the morning with my team. And then it just continues. We're prepping for the briefing room. But one thing that I will say, as you're asking me this question, is that it is an honor and a privilege to be the White House press secretary for the President of the United States. That is never lost on me. I am honored to be in this position. And it is, I would not be doing this job if I did not believe in what the president stands for and what he wants to do every day to deliver for the American people. Seriously, I would not be doing this job if it wasn't for President Biden. So I am honored to be here and to have this conversation with you, and hopefully I'll come back.
We'd love to have you back. White House Press Secretary Karine Jean-Pierre, thanks so much for being here.